and welcome to the Chaplain's Compass, where we explore the changing landscape of spiritual care. I am Alicia Tremaine.
And I'm John Betz. Well, today we're exploring a topic that is shaping the next generation of spiritual care: team based spirituality. This is an approach that brings chaplains, clinicians, and interprofessional teams together to support the whole person. We're honored to be joined by Dr. Alex Lyon. Dr. Alex is a pediatric neuro-oncologist, a researcher, and a leader in integrating spirituality into serious illness care. And we also have the Reverend Dr. Anastasia Holman, a board certified chaplain, ACPE certified educator, and a system director for spiritual care at IU Health, Indiana University Health. So thank you so much for being on our podcast. We're so excited to have you on here.
Good morning. Thank you for having us. Excited to be here.
Thank you.
Yes, welcome. We're very excited to talk to you, and we would like to start really just by knowing your backgrounds a little bit better. We are curious about how each of you came to the work of spiritual care in healthcare and in serious illness, and also how you personally arrived at your role today. So maybe start with you, Anastasia. What led you into chaplaincy education?
So, what led me into chaplaincy education? I started off in business and HR, and then after accepting my call to ministry, I did my first unit of CPE while I was in seminary. And even after he's our corporate chaplain now, Joe Colquitt said, "You would make a wonderful chaplain." I said, "Absolutely not." I had my own vision of what ministry would look like. When I accepted my call, I heard teach and preach. So I already had this put in my mind and the traditional forms in a congregation, a church, of what teaching and preaching would be. I worked for the Christian Church Disciples of Christ for a while as the minister of reconciliation. And while there, I was a part-time admin assistant. And I have nothing against admin assistants. And yet, while I was sitting there, I was being called to something else. And so I said, where can I go to still discern this teaching and preaching? And I was led to a chaplain residency program at a different healthcare system in Indianapolis. And while I was there, I would say I fell in love with chaplaincy. I didn't know it. I was with my husband at the time, and I'm telling him about a terminal wean, what not to do, what to do. I started really hearing the move of God, and he stated, "You're glowing. You must love what you're doing. You are glowing." And I was like, "Who, me?" And so starting to pay attention to what I would say the move of God and the move of the Spirit. And then as I'm sitting in my peer group, I'm looking across from my educator thinking and hearing once again, I can do that. And so it was a calling step by step. I'm one of those people when I first hear it, I tend to say no, or I laugh like Sarah. And it takes a minute. And so on that journey, I came back to IU Health to do my supervisory education training, and I've been here ever since. And so that's how I got into supervisory chaplaincy education, was through a journey and following a call and step by step.
A lot of discoveries along the way, it sounds like.
A lot of discovery along the way, listen to community, the move of my own spirituality, God's spirit in my faith tradition, and just journeying one step at a time.
How about you, Alex? First of all, how did you choose pediatric oncology? And then also, what sparked your interest in integrating religion and spirituality into your work?
I consider myself both a man of faith and a man of science. And early in my career decisions, I had chosen to do a double major in pre-med and in youth ministry. And I joke with people that I chose medicine because I went through a spiritual crisis. Um, and it really was in the practice of taking care of children that many of the things that are so complex that they might burn out people in ministry or cause them to be distracted, it called things into focus for me and reminded me what it really means to care for human beings and to love them well. And so I think I was drawn to those that are going through some of the darkest nights because I've still had that sense of there are resources beyond chemotherapy, beyond directing treatment at a tumor that people really need when they're going through that. As I regained my sense of spirituality and spiritual bearings, when I was in my fellowship for pediatric oncology, my wife and I, we adopted our second and third children. My youngest, my daughter, Kinsley, got really sick and was in our own pediatric intensive care unit for about a month. And that's when I recognized how much my own spiritual resources, the resources of my family, the spiritual resources of our faith community really came into play in coping with going through that, making decisions, and also connecting with our team around us at work. And so all of those things, I think, fostered this sense of the sacred at work and this sense that the profession of medicine really needs and really would benefit from addressing spirituality. As I continue to do that with working alongside chaplains, partnering with amazing people along the way, people like Chava Shalagi, and learning from really, I think of her as like the mother of spiritual history taking, Dr. Christina Pohalski, and then landing in this amazing partnership with Anastasia. I've seen over and over again times that my patients and their parents or caregivers, they really need this to be addressed. And there's a kind of spiritual distress, whether or not the patient's going to be cured, whatever is happening, from a medical, biologic standpoint, there's this invisible realm that people really need to have presence with.
Thanks for sharing that.
I love the idea of uh, the youth ministry with the medicine and uh, yeah, having worked in pediatric chaplaincy for a little bit over at Cincinnati Children's, the fact that play a lot of times is healthy medicine with peds. I love that. That's wonderful.
I'll say it since next week, I think season 5's coming out. One of the spiritual moments I had with a teenager once in my practice was um, talking about her favorite TV show, talking about Stranger Things. Um, and there was like this bond that formed, every time she would come for chemotherapy, we would talk about the latest episode or whatever. I think that's maybe a surprise for some people that that too is spiritual to be able to connect at that level.
Going with what you've been doing, what is the phrase that team-based spirituality, what does it mean to you both? And how do you define that?
So, Alex, if you will start, and I kind of have something to add.
Yeah, I think that team-based spirituality builds upon things that have been spoken already about interprofessional spiritual care, that there are spiritual care specialists, the chaplains, who many don't realize just how much training there is and just how much the vast depth of knowledge coming to understand that chaplain care is more than only religious care. It's both religious as well as for those who are not religious. And then recognizing that just like any body system, as a physician, I may not be a cardiologist or a gastroenterologist, but I need to know something general about all of the body systems so that if there is some dysfunction, some level of distress in that area of the person, I can um, do what I need to do in a kind of first aid setting, but then refer to the specialist. I think what we've expanded upon, though, is that this is patient centered and spirituality is a resource for the team itself. And this came out of some of our research in previous interprofessional settings that we have found as team members are learning to take good care of the patient, address spiritual distress, we naturally start to reflect on our own spiritual needs. And we naturally start to think about what are our own spiritual resources, and it normalizes talking about spirituality within the team, and that creates a more open environment to talk about spirituality. amongst people at work.
Do you think that's more needed now or just as before and we just didn't realize it? What changes are you seeing in healthcare settings or systems that are causing people to look beyond the chaplain for this kind of work?
Yeah, Anastasia, you might be able to speak to this with some of the bandwidth and some of the additional. I mean, I'm hearing it all the time, how many times chaplains are needed with also some scarce resources. You want to mention that as well as more about team-based spirituality?
For me, team-based spirituality is we've already mentioned center approach to focus center approach to for our team members as well, not just for the patient. And so it's beginning with the whole person, care for the team, and then eventually to the patient. Alex said it is a space to allow a person to really begin to look at their own spirituality and how it shows up in the space. And what I've learned as a scholar practitioner that if I'm not willing to look at my own spirituality, I will not make space for anyone else's spirituality. So just thinking of team-based spirituality. First, it starts with the individual team member, then it moves to the team, and then it's a continuity of care for the patient. So whole patient care, but yet team-based. And so I always say teamwork makes the dream work. And so if I am taking care of myself and then becoming a part of a well-integrated team, and then we can do the care that's available for our patients. And so, do I believe the approach is needed in healthcare now? Absolutely. I heard someone say, actually, I heard our executive vice president of mission and values say in a meeting that we're in a healthcare mental health crisis. And so just thinking about whole person care and starting, not leaving off the spirituality, it's mind, body, and spirit. And so they are all integrated and connected. And so it is needed in healthcare settings. I can see this being transformational because once I'm attuned to what helps me become whole and well, I can help others become whole and well. And the chaplain is a part of that. The specialists are a part of that. And walking alongside the generalists to make sure that we're not missing anything as a team or with our patients. And so, yes, it is much needed in healthcare right now.
Gosh, Anastasia, that sounds a lot like CPE, teaching people self reflection.
That's the lens that I'm always looking through. How can we do some action, reflection, new action? And how can we look for the gaps in the spaces that keep us, in my terminology, to the margins, bound, not functioning in our well-being? So what do we need to do to help others begin to tap into what's most meaningful for them to kind of bridge the gap?
So, can you walk us through the components of this curriculum that you all have designed? Who participates? How do you recruit folks? What are the key modules? Like, just tell us a little bit about how that works.
One thing to maybe just start out by saying is we approached the curriculum with the idea that the medium is the message. We eschewed um, technology online initially, and in the curriculum is essentially a book that can be read together as a team. And there are reflection questions embedded in it. I think part of this was the influence of one of our partners, Rabbi Bruce Pfeffer, a chaplain who taught us about the Havruta method in the Jewish tradition, that you read a text together, reflect on it together, and that it stems from the word for friendship. And you think about, um, that engagement question that some people hate, do you have a best friend at work? On a positive way to say it, like, I think a lot of people at work want to have other friends, people that they can actually express their spiritual needs to, or even share what has helped them spiritually today. In order to do that, the curriculum goes through what is spirituality and what are the distinctions, what are the connections with religious faith, and just acknowledging the different ways that different people, not only in between spiritual backgrounds, but also within even one tradition may have vastly different ways that they have approached meaning and purpose and in connection to the transcendent. We've also thought about how spirituality and spiritual practices may differ geographically. This was developed with initially um, the passion for our own state, our own healthcare system, and so there's a chapter looking at what is the breakdown of how people identify within our state. And as we develop this further to be applicable to others, I think there's going to be some reflection questions on here's some, whether it's Pew studies or outside resources, what are the things that are, particular to your state, to your geography? What are the differences you see? Who are the people that you serve? From there, there's a lot about what the chaplain does. There's an expansive chapter on that, which I'll share one story. As we were putting on the initial facilitator training for the curriculum, that one of the chaplains came out of it and said, I cannot remember a time that I have felt so validated and so valued to hear within a group just a celebration of like all that I have done to train and to be educated as a chaplain. And I think that that security is really important in an interprofessional setting because as you have a generalist learning some of the, in a sense, low hanging fruit, things that anybody could learn, there has to be this sense that we're doing this to be partners and there's not going to be any risk to your own profession. If anything, this is going to build it. We've had some instances where teams going and taking this curriculum have actually used it to advocate for more FTE in chaplaincy.
When people know what we're doing, then they're more likely to use us. They're more likely to didn't mean to interrupt you, but yeah, I found the same thing.
That's, about midway through or a little bit before midway through the curriculum. In reference to spiritual history taking, we use the spiritual care assessment intervention, which was developed by my mentor, Dr. Lexi Torkey, and her colleagues here at IU Health. And the distinction with, what is the full spiritual assessment that a chaplain is going to do. One of the distinctions is number one, there's going to be less questions. There might be just one or two used by a physician or a nurse, social worker, psychologist. But the second is also recognizing when spiritual distress that is discerned is simple or complex. And there's, a simple spiritual distress that sometimes is just giving silence, like providing silence and not continuing to speak. As a physician, that's hard to teach. I think there's a lot of research on that. How many words do we speak in a setting, and how many times we accidentally will interrupt patients. Um, and it could be that the answer is not teaching a physician to just listen well. It may be the answer is teaching a physician to see their interview process as part of spiritual care, that you are actually doing generalist spiritual care. And when you're focused on spirit, on spiritual resources, spiritual distress, that's when it's going to be natural to have times of silence.
So I love this concept of reading a book together and discussing it. But I'm wondering, first of all, how do you get people in healthcare to have the time to do that? And second, who is coming to this? Who participates and how do you get them there?
We had our first train the trainer. We actually asked the chaplains to invite a clinician or a partner from their unit to come to the train the trainer. We were in this large room, full to capacity. Alex, how many people would you say we had in our first train the trainer?
I think there were over 60.
60. Um, Pairs that came. And so it was a chaplain and their partner on the unit as part of the team to take it back to the team. And we sat there for 2 days. And actually, read through the curriculum. So we modeled what it would, our intentions and what it would be like. What we found is when our chaplains and their clinician, the pair would take it back to their unit, we found that people were busy. It was hard for people to sit and read in chunks like we wanted. We had some people say, that doesn't work for us. PowerPoints got introduced. And so we had one team that did their own PowerPoint. So we added that to the curriculum. So then we started spreading the word. Our own healthy results department did it. The structure was hybrid. So there were some in person and some online. Our environmental service worker team did it with a chaplain, and she came in on and did it with evenings. She got the buy in of the manager. And so it just began to spread the word. What is the need? How can we meet your need with your busyness and your schedule to make sure that people got the training? So it evolved over time. And what it was the two going out, spreading the word. Alex and I continuing to talk to other leaders about it and just using our influence as a team to say when a unit said we want this, how can we make it work for that team to ensure that the training is done? And we've had success stories. People like, I appreciate it. I grew in my capacity, in my own capacity of spirituality. Now I know what to look for in someone else. And so that's how we begin to do the work. And that's still how we're doing the work, is just talking to people about the benefit, welcoming them, and creating what I like to call a sacred space to do this meaningful work that we're doing, having one person, one team at a time begin to engage the work.
And it sounds like you've created a buzz or some excitement too for people to feel connected with the meaning of their work, which is amazing.
I know that was a part of the vision that Alex. So I became a part of the team, and we have a team ourselves just to do this work. Alex mentioned Rabbi Bruce Pfeffer, Dr. Mona Rayad, she was at IU Health and now she's at another medical center. The VP of Spiritual Care, Jay Foster, one of our colleagues, the director of chaplaincy for the AHC, Reverend Dr. Vern Farnham, our research chaplain, Shelley Varner Perez. And so it takes a team and a village to really begin to do the work. Although Alex, Mona, and I wrote the curriculum, it took everyone to be a part of this initiative. And that's not even including the researchers outside the team that I'm talking about. They're really working together to do this work, which is a model representation of team-based spirituality in and of itself.
Could you share a memorable story or a few from the field um, on how the team-based spiritual care approach made a difference? Like where you could see the collaboration take place across the disciplines from chaplain, physician, nurse, social worker, et cetera, et cetera, et cetera.
I think about a number of children in my practice and a number of diagnoses which are still considered to be incurable. And one in particular, I would think of as like the quintessential incurable brain cancer in children, diffuse intrinsic pontine glioma, DIPG. As a neuro-oncologist, as a pediatric oncologist, we're all trained to try to save the life of a child. And when we have a patient that you're not going to be able to cure them, how do you approach their care and what are you focused on? These were questions that had come up as we had some initial trainings early on, not only within oncology, but with neurosurgery. Sometimes families will come and say, we're praying for a miracle. And for some physicians, many physicians, that's a scary statement. How do I stay in the space with the family that has their eye on something that's very different than what I can see with the science of medicine? And how do I stay with them? How do I walk alongside them? One time a family member had made the statement, I feel like I'm losing my faith because this isn't what we were praying for. This, sharing the bad news that this is a incurable brain cancer. And I remember the neurosurgeon who had done some of the training. He made this statement to the family member after a moment of silence. There was silence. And then he said, maybe maybe your faith is still valid. Maybe this is not invalidating it. Anyone would struggle. And, we just asked a little bit more. And then eventually I said, we have a team member, their entire specialty is around sitting with people who are struggling with these kinds of questions. Would it be okay if we invite, um, our team member who's a chaplain? That I recommend this. I think it will help you. And they said yes. And so the chaplain spent her time with them. And I remember afterwards, it was like a kind of in a way, a debrief, but also just talking about their story. And she said, I simply asked them, is there any room in your faith community, in your belief system, for the possibility that when you pray for a miracle, it may not happen? And, the family member said, yes, there is room for that. And you're right. You're right. Like my faith is not invalidated by this. Like many families, they look for clinical trials, which might take them anywhere around the country because at any given moment, our centers may have this particular trial and another center might have another. It's part of the beauty of neuro-oncology is we refer outside of our system if we don't have what they need at that moment. So I remember referring them out in the outside system. Their neuro-oncologist came back to me and said, they told me what an amazing job you did caring for them. And they said they are so thankful for everything you did. And I thought to myself, from a standpoint of attacking the cancer, treating, trying to kill this cancer, we didn't do anything. And yet we did exactly what they needed and we were there for them. And so I think that is the power of spiritual care, of being partners with chaplaincy. Um, there are ways to win no matter what.
It's like the old adage that people don't remember really what you do, but they remember how you made them feel.
Yeah, how often people who express their hopes in a healthcare setting feel dismissed or just not acknowledged because you're right, Alex. People don't know what to do with that. Sometimes it's a conversation. The conversation ends because people are so afraid of acknowledging even that hope and meeting people where they are. So I'm thinking about how you all have described people having more self reflection as they discuss their own spirituality. And I think you said, Anastasia, they feel like their capacity has increased and how they are now able to see the value in the role of the chaplain, which I love how you said, I recommend this person to come meet with you. How do you teach non-specialists, generalists in spiritual care to be truly inclusive of all the religions and spirituality, the diversity that our patients have in their spirituality, and to be welcoming and to make room for all of that. Sometimes that's hard even for beginner chaplains to do.
So we recognize that as a team, and we were intentional about putting in the curriculum that we do not proselytize, like that it's written in black and white. So as we are reading about it, it also allows for conversation if someone doesn't know what that means, or it opens up a space within the team that is doing the work to begin to talk about the differences that are even in the room and how to create a place of hospitality as I'm journeying alongside someone else. But I would just want to repeat it again. We were intentional about putting it into the curriculum. This is not our role. This is not why we're doing it. What we want to do is open up a space and make it inclusive for all people to come, even for people who say, I'm not spiritual, even for the person, I don't have a faith. So, how do we journey with them as well without making someone feel judged, ostracized, marginalized, which only would add, I would say, spiritual distress versus a place of spiritual healing and hope. So, our curriculum is very intentional, just explicit. Don't do it.
And again, like the medium is the message. I remember during our facilitator training, we had food, we had lunch times, we had dinner time. We invited people to have times of prayer before each meal, and we had different people from different backgrounds lead those. And so I remember, Anastasia praying according to what is familiar to Christian, the Christian faith. I remember Dr. Mona Ryad singing a Muslim prayer before a meal. And I remember Rabbi Bruce. I don't think he was originally planning to sing his prayer, but because Mona had sung her, he's like, "Oh, okay, I'm gonna sing my prayer now." And so that beauty of celebrating each other's backgrounds, I think some of it was someone might say serendipitous, others might say ordained. We had people early on willing to be courageous, speak out about how different this was from their own background. So I remember one of the early stages of this, one of the neurosurgeons saying, "I'm an atheist and I just want to take really good care of my patients." And and being willing to step out into that, I think that's really enhanced the richness of, again, the team. We're not individuals. We bring with us, though, each of our own spiritual traditions and communities potentially into this space. And then we learn how to work together for the common goal of taking care of the patient.
And I want to add to that, Alex, you reminded me that even some of our poems in the actual curriculum were written by one of the medical students doing religion and spirituality in medicine scholarly concentration, and her background was is Hindu. Um, and so just the poems and different voices that are actually in the curriculum also model the inclusive model of care and compassion that we hope to bring with team-based spirituality. And another way to model, all are welcome. I'm Methodist, and so all are welcomed at the table. Like all are welcome. And so I would say team-based spirituality is that model. All are welcome to feast off of the goodness. Hopefully, will transform people to really begin to say, I can show up with my full self to do this work, and I can allow my team members and my patients to show up with their full selves.
Well, I think, for a lot of people who feel the need to proselytize, it's almost like they feel that we need to bring something to that person is hurting, and I have some kind of answer. But when you show the gifts in all of us that are already present and you're able to recognize that, I can see how people are able to take a step back and pause and affirm what's already in that person. It's beautiful.
How do they take the role? Are they the go-to spiritual specialists? Uh, how do they partner with the overall team? What is their role?
So as we wrote the curriculum, and I don't want to speak for Alex, and yet we work so well together. I know that the idea was to highlight the chaplain. And so the collaborative approach, and it's amazing. And I think Alex may have talked about this already. People are surprised with the level of study, the level of expertise, our role in the spiritual realm. And so we come alongside our our team members, journeying with them the same way we would journey with the patient, and letting them rely on us if there's something that gets scary, or I don't want to handle that, or I need to step back because that's not my lane. In the model of team-based spirituality, we talk about three different models of working on a team. And so it's all about team-based approach. So I have been in situations, even hearing Alex talk today, I don't know if you noticed, I got kind of quiet because when I work with him, I am amazed, not amazed in a bad way, but just my heart is overwhelmed with how he is with patients, how he is kind and compassionate. And so I would see him also as a specialist. Like he has a knack for. So there are some team members who have a knack that as a chaplain, I'm coming alongside you and we're standing strong together. And I'm not necessarily have to always be in the front. It just depends on the need of the team. And so I would always say, we're as a chaplain, I'm always assessing. What is the best fit and what is the best intervention for this moment? And what is my role on the team? Sometimes I don't have to be the specialist. Sometimes someone who considers themselves a generalist does a better job than I do as a specialist because we know on certain days, kind of like my internet connection, I may not always be at my best to show up in a space, but I know I have a team member who can step in and do that work. So the more that we can work together and model for each other and do the collaboration. So yes, I'm a specialist, but it takes all of us to do the kind of care that is needing for wholeness and well-being in our healthcare systems. It's not one without the other. It's not either or. So I'm using a lot of CPE. It's both and. Like it takes an entire team, and there are no lone rangers. And so the role of the chaplain is to maybe lead in the spirituality area, but I'm not the only one who can do.
Many of us can remember or relate to an experience where the chaplain was not present with the patient, either because the patient refused a chaplain or for any reason, but can still consult with the team and provide some spiritual support and lift up things that maybe the team is not recognizing in the moment. So sometimes the chaplain does work behind the scenes or in consultation. Anastasia's talked about interventions, so that made me curious, and I wanted to talk to you all about maybe some research and metrics as well. And I know, Alex, you've published a lot of interesting research on chaplain notes and how that helps inform the care team about prayer with physicians, leading prayers, or talk about miracles that you've already mentioned, and just spiritual care in general. So I'm wondering if there were some findings from your research that help inform this curriculum, and also if you're able to measure, are you using any metrics to measure the impact of the team-based spirituality interventions?
I think that both quantitative and qualitative methods are able to be used and should be. Um, and, I want to encourage chaplains that are sometimes hesitant or struggle with thinking about measuring what they do. There are things that can be measured, and there are some things that you will not be able to put into numbers, but you might be able to put into words with qualitative methods. And one of the things that we found qualitatively early on was that um, when we think about training spiritual care generalists, it enhances the spirituality in the team, and it improves spiritual wellness within the team. That was part of the lead point in grant funding. The system was looking for, how do we enhance the wellness of team members in such a way that it's not an add-on. There's many programs, wellness programs, employee assistance programs, but they're outside of the flow of medicine, the flow of daily care. And we think the way to enhance the wellness of team members is to teach them to address the spiritual needs of patients, because you are in the process of taking care of the patient, recognizing that invisible space that cannot be measured. And that's where you're going to start to focus on things outside of simply, how many line infections do you have? What are the patient outcomes? Does the patient live? Does the patient die? And you start to recognize there is so much more to medicine than what can be measured. And so I think that both the quantitative and qualitative methods are needed. One of the challenges, I think, is going to be, how do you capture spiritual health in a measurement tool? And is it possible that there are things that are spiritually healthy that may not look like the outcome a healthcare system would want? Might it be good for a person to leave their healthcare system as their spiritual development? Could it be that a person is not producing the highest relative value units, RVUs, in the healthcare system, having, more and more patients, capturing market share? It could be that as you think about spiritual wellness And if the C-suite and others in management would actually look at this carefully, spiritual health may change the way healthcare systems look at what is success in the marketplace.
Alex, so I got quiet because I'm like, preach. I mean, that right there.
I know. I was like, "Can you say that again?"
Well, when Anastasia and Mona and I are writing this text, there's a chapter on spiritual wellness, but also leadership in opening space, right? We think about the heterogeneity we've seen in our own healthcare system, and we think is probably there in all of the healthcare systems, that there are certain spaces in the hospital or clinics where chaplains feel more welcome and other places where they don't feel as welcome. Similarly, there are areas of the hospital systems and clinic systems where spirituality programs are going to be taken up more easily. And part of what, might be actually closing in, you think about space opening or closing, there are certain things that are dysfunctions within American healthcare that need to be called out. And so even in our spiritual wellness chapter, we talk about systemic issues of spiritual dysfunction. And some of those include things like greed and dysfunctional competition, which is why, for us, when we've had team members that have left the system and gone elsewhere, we've actually felt like this work has synergized and built up. And it was a surprise to us that that happened. And it reminded us, um, multiple systems could be working together on this kind of a thing. And it might take a profession which has made, in some ways, less money for systems. And sometimes is at the most risk of when the bottom line is getting tight, having the pressures on them. It might take something like the profession of chaplaincy to remind people that everybody across systems are actually working towards the common goal of taking care of people.
And I couldn't have said it better myself. And I was as you're saying that, what came to me, there is no competition. When you were saying going outside of a system, there is no competition, but that leads to a wider footprint and actually more doors being opened in other healthcare systems to do this type of work. And so while it may have started at IU Health, um, and we are proud that it started at IU Health, we our dream is that it would spread across systems to begin to do what Alex has talked about is dismantling some of the systemic oppressions that keep people from being well. And if that is the outcome of healthcare or moving towards wellness, then part of spirituality has to be a part of that.
So, what lessons have you all learned about scaling this system wide? What advice would you give to other organizations looking to even begin this work? What are some common pitfalls that you've encountered, or what would they need to have to be successful?
I think one is recognizing their champions, and people who, like ourselves, we came into healthcare with almost like an antenna, ability to sense there's something missing or there is spiritual distress. There's something more than simply, writing my note about the patient's symptoms. There's something also underneath all that. And so finding those champions, spreading a wide net. We put the call out. We made it very easy for people to join. We also had champions within leadership, and talking to the balance of what I shared about is having a system that the leadership is ready and willing to help. And so at our first facilitator training, we had two vice presidents of the system present with us. And we had people from the C-suite from the children's hospital present. They came in ready to be there. I think that another thing we've seen is be willing to release what you've written and be willing for other people to adapt it according to their needs. Some people took the curriculum that we were like, oh, this is a book. This is a book to be read. And they said, we really, really like PowerPoint. Like, can we make slides? Or to say, we don't think we could do a full 2 day. Can we do a lunchtime this many number of times, and to let people, adapt as they need it. I think there's a stability in the substance of it that it doesn't change the core substance of it by letting them use it as they need it in their particular setting.
I was gonna say the same thing, learn how to pivot and be flexible. Also sponsorship, collaboration, um, also checking in with self. What is my goal, priority? Am I doing this for self? Am I doing this to ensure that people are becoming well? And also, Alex is so gracious and kind. When they would come, people would come and say, I want to do a PowerPoint. I'm like, no, it's a book. He didn't know I was thinking that way because I never said it. He would lead, and we'd be like, no, they can do that if they like. And I was like, what? No, this is how we set it up. So not be so rigid. Remember I told you somebody said, you should be a chaplain. I said, no. Like, no, it's a book. It's a book. Get it. Um, and then even doing hybrid. So there was some chapters, when I was with a trainer, they preferred PowerPoint. So when they did their section, they would, PowerPoint. When it was my turn, we would switch over and read. So showing that working once again, modeling how to work as a team. Letting go of the outcome, I think is the other thing I would say. Um, we started off, we said, oh, we're going to have 25 teams trained. Well, working in a healthcare systems happen. It does what it does. Systems do what they do. We had to scale down our goal for the first year as we were training. So being able to pivot when things don't work out the way we hope, and then coming up, looking at the gaps, and then changing the process and the trajectory of where we will go the next time. And so that's what we've been doing.
For those that are starting out, um, I also want to encourage you just thinking about that idea of scaling down. I mean, that's the opposite of what systems are looking to do, right? They're looking for reach, they're looking for scaling up. But there's this quote, it's often attributed to Oscar Romero that I wanted to share, and it's encouraged me. It says, no statement says all that could be said. No program accomplishes the whole mission. No set of goals and objective includes everything. This is what we're about. We plant the seeds that one day will grow. We water the seeds already planted, knowing that they hold future promise. We lay foundations that will need further development. We provide seed that produces effects far beyond our capabilities. We cannot do everything, and there is a sense of liberation in realizing that. This enables us to do something and to do it well. It may be incomplete, but it is a beginning, a step along the way, an opportunity for grace to enter and do the rest. We may never see the end results, but that is the difference between the master builder and the worker. We are workers, not master builders. To paraphrase, we are team members, not messiahs. We are prophets of a future not our own.
Just as I am without a How could we just keep on going after that? I love that. That's wonderful.
Well, Alex, I really want to thank you for seeing the value of chaplaincy and spiritual care and writing about it, publishing about it. I think that's such a contribution to our field, to our vocation. I'm truly personally thankful for that. And I'm also wondering if you could choose one big question for the field of spiritual care in medicine or healthcare to answer in the next decade. What would that be?
Well, I'll speak from my own faith tradition and share something I see on the horizon and is already here, which is there are more and more Christians who believe miracles are being done today. And I think that a big question for physicians in the future and right now is going to be what can medicine learn from the theology of miracles? And I think that some of those questions are going to need theologians from diverse traditions to look at what are the different ways people believe in miracles or miracle healing, and how does that influence the way that they interact with healthcare? And in turn, what can we do to understand that better so that physicians are not caught in the headlights? And I believe that it's going to require a deeper partnership with chaplaincy, who are often, in a sense, the interpreters between communities and cultures, and often have the theological foundation to be able to ask some of these questions in a way that maybe some physicians don't have that background, and that is going to also point to some of the work I think Anastasia has done in a few different systems around partnerships between chaplains and congregations with things like congregational care network.
So, Alex, after all of this, I love hearing a lot of what you've been doing. What is giving you life these days?
I have some spiritual practices that help me as a neuro-oncologist. I have a particular spot in my closet that's like my prayer spot. And, in a contrast to maybe some ways of praying that are asking for things, speaking, filling the space with words, I often will just sit and meditate on how much God loves me. And that causes just tension throughout my body, the wounds, the burdens I've bared as I've walked alongside families to release those. I think the other part of it, again, like thinking about fun, working with children. My wife and I spend a lot of time with our children, and each one has unique gifts and things that are just fun, right? So my oldest son, he has a metal band, and so I go with him to metal concerts. I enjoy going to his concerts, his gigs, as he would call them. My younger son is an athlete, so I get to go to his basketball games, his football games. I do not say 6'7" at his basketball games. Um, I have my boundaries. Um, and then my daughter, she is a kid after my own heart. I love comic books, always have since I was a child. She's a comic book fan, an X-Men fan. And then lately, of all things, she got into this cartoon that was like one of my favorites from the 1980s, Thundercats. And so that's what we've been watching lately.
So, wow. Okay. Um, I would love to hear, Anastasia, your answer to that. I'd love to hear. So, what is giving you life these days?
Thank you for asking that, John. As we are living in this world today, and the tension that is happening in the world, and then working in a space of healthcare, I really heard in from my faith tradition, I heard in my spirit, find the places and the spaces that will bring you joy, what will feed your soul. And so I found that to be family. I'm enjoying being a Gigi. My granddaughter is 15 months old. So anytime I think about her, say her name, look at her picture, it's just like overwhelming. There's still goodness in the world, those spaces. Talking to my children every day. My youngest and I, she moved out of Indiana. And on Tuesday nights, we get together and we were watching Only Murder in the Building. And so we would and so every Tuesday night, we have a kinda date night, and now we watch 911 and sit there and laugh and talk about the crazy things that are happening, laughing. I speak to my children every day, celebrating with them, finding my sister circles that bring meaning, devotion, worships, places of worship, my place of worship, exercise, and so walking, prayer walks, yoga, um coloring, so trying to use a different part of the brain, but really seeking out those spaces that are going to feed my soul and my spirit. I'm being mindful of where I'm spending my energy, and if it is causing harm, I remove myself. So I'll say even, I was probably a CNN. It was popping on my phone. I stopped all of that. I engage where I want to engage now versus allowing it to saturate me. So really being intentional about rest also. Rest is Resistant. Read that book and just starting to incorporate more rest into my life. So those are some things that I'm really trying to be mindful of my spirit. And I'm recognizing also in this season that the same thing that worked before may not be working now. So being open to other spiritual disciplines to make sure that I'm staying refreshed and renewed. I have one sister circle. We all graduated seminary together. We've been doing morning prayers. I have a prayer partner. So, really tapping into prayer more to utilize that to keep myself grounded. So, those are some things that I'm doing in this time, this space, and with this work to keep myself safe, sane, and grounded. Oh, therapy. Let me say therapy. Therapy, therapy, and therapy. I also have a career coach. So using outside partners to collaborate. Yes.
Yeah, having those safe places where you're able to be real, uh, be working on things, but it's outside of the family, it's outside of the profession, it's yeah, so important.
Yes. And then me and my husband also hanging out. So just we're empty nesters, so learning how to do that, uh, be in relationship again. And once again, anything you say about my grandchild, I'm all for it. It changes my whole countenance. I'm like, yes. So brings me joy.
I have loved learning about what you all are doing at IU Health. I'm so impressed, and curious even to learn more. So you've even piqued my curiosity more. And if it's done the same for our listeners, I have good news, which is that Anastasia and Alex are leading a workshop at the 2026 APC conference in New Orleans. So if you're curious, you have questions for them, mark your date, mark your calendar, come to the conference and sign up for their workshop. So I know I will.
Thank you. And we would love to have you. And that's part, just continue to share the work that we're doing. Um, so that people can be whole and well. That's just my ultimate, how to create a sacred enough space so that people can do the work that their souls must have. The Reverend Dr. Katie Geneva Cannon would say, everyone must find the work that their souls must have. I believe that my role is to create that space for that work. So thank you today. This has been a process. We'll say that just like say spirituality, it has been a process. So, but really, thank you so much. Anytime that we can partner again, please let me know. This has been wonderful. And I also, if I could say, thank you for the work. Uh, that you two are doing to pave the way to create a space so that chaplains or whoever would like to hear about the work and the vocation and the ministry and the jobs that we do, how valuable and important it is. So just thank you for accepting, saying yes to your call to do this great work.
That's amazing. Thank you so much, Anastasia.
Now it's time for the non-anxious presence with Elise Tremaine.
And John Betts. Well, that was a really rewarding discussion. I'm very thankful that they were able to explain a lot of the collaboration that they've been able to do with one another, with their team, to be able to make the case not just for chaplains, but to be able to partner with them and make it clear to the interdisciplinary team, like, what chaplains do, but also that they could partner with us and be integrated in the kind of work that we do as well.
Yeah, it makes a lot of sense for me that when people understand, first of all, their own spirituality and how that impacts their healthcare in every really dimension of their lives, but also when they understand what a chaplain does and the training that chaplains bring and the value of the chaplain, that they're much more likely to first recognize spiritual distress and second, refer to this chaplain. So it makes a lot of sense to help members of the team have that kind of awareness. It reminded me of, I was having all kinds of memories as they were talking, but most of it was from starting out as a chaplain, either in residency or as an intern, or just coming to be a chaplain at a new hospital that didn't really understand a lot about chaplaincy. The work, sometimes it can really feel invalidating when people don't understand what you do or the value that you bring. And sometimes you get really inappropriate referrals as well. And it has taken chaplains a lot of work, I think, to educate our teams.
Sometimes that education can, because the teams move on and some people leave, this is a continual education piece, which is needed to be able to tell people, okay, this is what chaplains do. This is also what you do, and this is how you can partner with them. And my favorite thing to always hear is, "Oh, I didn't know chaplains did that." Yeah, yeah,
And it's probably not unlike, when palliative care became a specialty, and you have to explain that people are board certified in palliative care and or what palliative care is there to do and how it is valuable. So we're not the only ones fighting those battles, but
right, yeah. No, but it's a never-ending battle.
I also liked how, this spirituality, team-based spirituality is a resource for the team's well-being, and how that's really been the focus of their grant. I don't think I understood that to begin with, that, it is about providing better patient care and caring for the whole person, but it's really from the lens of this is going to help our team's well-being and resilience and being connected with their work, but also building their capacity, as they said, which is, again, makes a lot of sense and it's beautiful. But I don't know that many healthcare systems are looking at that from those lands.
What I loved his Oscar Romero quote. As I was listening to that, I kept on thinking about the powerful witness of, Archbishop Romero, and it made me think about this quote from the Feast of the Transfiguration in 1977. He proclaimed, "Beautiful is the moment in which we understand that we are no longer individuals, but one body, united in our hope and in our struggle. God calls us not to isolation, but to communion, and it is together that we discover the courage to heal the pain of the world." I love how at Chaplin's Compass, we try to hold this truth close that spiritual care belongs and begins with the clinician's own spirit and flows outward into the widening circles, into the team, the patient, and across the entire health system. And here, Romero reminds us that we're one body. We are united in hope for the real work of holistic healing because we're not just bodies. Um, and we don't enter this calling alone and walk into it like communion with our colleagues, our patients, and the transcendent one who gives us courage. So
I love it. And I love how Alex put it, we're team members, not messiahs. Well, that's a great way to end. Thank you all for listening. Please share this episode with your friends, and we hope to join us again. Have a good day.